funeral industry is struggling to keep up with the rapidly increasing death toll caused by the coronavirus pandemic. Already, around 11,000 people have died from the virus in the United States, and tens of thousands more lives are projected to be lost. The numbers have created an unprecedented bottleneck at morgues, funeral homes, and cemeteries.
We have seen hospitals and even private funeral homes struggle in the wake of COVID-19. Now even the city medical examiner is changing policy. Starting now, they will send unclaimed bodies at the city morgue to be buried here at Hart Island after just 6 days, as the city struggles on how to treat coronavirus victims with dignity after death.
Pat Marmo, a funeral director and owner of 6 funeral homes in Brooklyn. Before COVID-19, Pat typically had 40 open cases on his roster.
When I went to visit, the company had 61 bodies on its roster, and 15 of those were COVID-19 bodies.
But by April 6th, his roster had 300 cases.
No funeral home has the infrastructure to handle such volume. None.
Rodriguez is a funeral director in Queens, but for days now, his phone has not stopped ringing.
Because we're getting families crying on the phone to us.
As the city's system for burials is completely overwhelmed. Rodriguez was scheduled to pick up the remains of 2 people for cremation today from Elmhurst Hospital. Instead, the remains were loaded into trailers like this one.
Now what's happening is doctors that don't have confirmed case of COVID, they're putting pneumonia. So now they're not accepting this cause of death. So we have to wait to get the right cause of death that would be cleared for cremation.
It's taking up to 3 days to get a death certificate fixed.
The other problem we're having is we're not getting death certificates online quick enough. The doctors are overwhelmed. So the person's in the hospital for an extra day or so because the death certificate's not signed.
Τις τοξικομανείς, απλά τώρα έχουμε λίγο τρομοκρατηθεί περισσότερο. Γιατί πηγαίνουμε σε περιστατικά που είναι σε σύψη, που δεν ξέρουμε τι έχουνε.
Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying.
Leaders in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine.
Healthcare workers around the world are asking for help. They're in desperate need of more PPE, also known as personal protective equipment. Stocks of the critical gear are disappearing during the coronavirus pandemic. Doctors say they are rationing gloves, reusing masks, and raiding hardware stores.
Ventilators, ventilators, ventilators. We need 30,000. We have, in the existing hospital system, 4,000 ventilators. This is just in the normal operation of hospitals, etc. We have purchased 7,000, and we are still shopping.